This podcast is brought to you by BioCeuticals Clinical. The BioCeuticals Clinical brand exists to support clinicians like you with a practitioner-only range designed for clinical precision and therapeutic impact. BioCeuticals Clinical supports clinicians with patients who need specialized care. Developed by experts for clinicians with complex formulas, higher doses, and new ingredients, we create advanced solutions with expert care. BioCeuticals Clinical products are a practitioner-only range of nutritional supplements and complementary medicines which are intended to be recommended and/or dispensed by qualified healthcare professionals. Learn more at bioceuticals.com.au/clinical.
Hi and welcome to FX Medicine by BioCeuticals, where we bring you the latest in evidence-based, integrative, functional and complementary medicine. I begin today by acknowledging the traditional custodians of land throughout Australia and the connections to land, sea and community. We pay our respect to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander people today. I'm Dr Adrian Lopresti, and today I had the honour of hosting this FX Medicine Perspectives podcast. As usual, we're joined by my fellow FX Medicine ambassadors, Emma Sutherland, Lisa Costa-Bir, and Dr Michelle Woolhouse. Welcome, Michelle.
Hi, Adrian. Hi, everyone. Great to be here.
Welcome, Emma.
Hi, Adrian. How are you?
I'm great. It's great to have you on board today.
Thank you. Looking forward to it.
And Lisa, welcome.
Hi, everyone. So good to be here.
It's great to have everybody on board. Now today we also have the pleasure of welcoming a new addition to the FX Medicine Ambassador team, and that's Michael Alexander. Mick has 25 years of clinical experience as an integrative pharmacist and naturopath, and as a researcher and a writer. Let's all welcome Mick to the team.
Hi, Mick.
Hey, Mick.
Hey, Mick. Welcome.
Hello, thanks very much. Thanks very much for the welcome.
So Mick, can you tell us a little bit about yourself? We'd love to know a little bit more about you and your work.
Sure. As you said, I'm a naturopath and a pharmacist. I had an integrative pharmacy here in Victoria for over 20 years. During that time, I kind of dabbled in some other things. I wrote articles for the Journal of Complementary Medicine. I was involved in an educational program for a few years called The Essentials of Complementary Medicine. It was a CD program, so it's kind of showing my age there, sorry. I was involved with an educational for the final year students at La Trobe Uni in Bendigo. They had this set up where they would learn a little bit about complementary medicines if they were going out into community pharmacy, so I was involved with that. And I also contributed a couple of chapters to Clinical Naturopathy, a book by John Wardle and Jerome Saris. So that kind of got me interested in researching, writing and presenting a bit more, which really became more of a love for what I wanted to do. And at the same time, I really got a buzz helping people who really wanted to combine natural supplements with their conventional medication. So that kind of really ticked a few boxes for me. So during COVID, I decided to sell my pharmacy, and these days I do still work a little bit in community pharmacy, but I research, write and present information about combining supplements with conventional medication. So it increases the clarity and the confidence of people that really want to do that. And the good thing about what I do now is I get to talk to other people, creative health professionals, and I get to hang around with guys like you.
That's great. Well, thanks, Mick. I know you're going to be a fantastic addition to the team, and it's definitely great to have you on board, so welcome. Now, on to today's topic, which is sleep. Now, sleep is an integral part of our overall health and well-being, and the research continually shows that it has a significant effect on our physical and mental well-being. So there's consistent research showing that good sleep, healthy sleep, is really beneficial for both our physical and mental health. And the problem is that poor sleep can affect people of all ages. Research shows that parents of infants and children, about a third of parents report problems with their children either falling asleep or staying asleep. Unfortunately, the problem doesn't end there, and the sleep problems continue as we age. So again, research shows that about 2/3 of teenagers have at least one sleep-related problem. And 50% of older adults complain of sleep problems. So we see that it's such a pervasive problem that continues throughout the years as we continue to age. So the extent of the problem is a significant effect on the community. It is extremely important for us as health practitioners to know more about sleep, more about the drivers of poor sleep and the factors that contribute to good sleep, and obviously treatment strategies that can help improve our clients' sleep. So we hope that today we FX medicine practitioners can impart our knowledge and our clinical experience to help people learn more about sleep and things that they can do to help improve sleep in their clients. So in this part one of the two-part podcast series, we'll cover the fundamentals of sleep, the pathophysiology associated with insomnia, and we'll cover some tools to help better identify the drivers of sleep problems in our clients. So let's get to it. Now, as I've already mentioned a couple of key stats about the prevalence of sleep problems. When it comes to Australian-based research, generally the research on Australian populations suggests that nearly half of all Australian adults report at least 2 sleep-related problems. And that's just in the general community. So if we think about the people that are actually coming into clinic, we would expect that the symptoms of sleep problems are far worse. And certainly with my experience in working with clients with anxiety and depression and other mental health-related problems, sleep-related problems are certainly far greater than the 50% of individuals that come in and see me. But unfortunately, there are many myths that are widely promoted about sleep. And the first thing I want to do is cover some of those myths today. So one myth for me that frustrates me is that we can train our body to get used to a lack of sleep, is the myth that's often promoted out there. And it's often promoted by high-profile entrepreneurs and celebrities, who often claim that they only need 3 to 4 hours of sleep a night. And it's almost considered a bit of a badge of honour that if you sleep less, that you're more productive and you're going to be more successful in life. But the reality is that chronic short sleep disruption and short sleep can significantly affect our physical and mental well-being. Poor sleep, it actually makes us less productive, it makes us less efficient, it impacts on our cognitive abilities, it impacts on our ability to pay attention. So we do not get used to poor or to short sleep. So that's a myth that I want to dispel today. So Lisa, can you tell us about a sleep myth that you've encountered and want to dispel today?
All right, Adrian. So my biggest myth I want to dispel follows a similar vein to yours, and it's really around sleep timing and quantity. So I think most of our practice listening will understand that it's well established that for most people, 7 to 9 hours of sleep is considered optimal. However, I think people often hear 7 to 9 hours and think they can get these hours in at any time. So for example, if I go to bed at 3 a.m. and sleep till 10 a.m, then that's fine because I got 7 hours in. Unfortunately, what the research tells us is that this isn't quite true because different cells and organs within our body are doing different things at various points of the night. And so if we're awake when we should be asleep, things start to malfunction. So what's going on is that in the hypothalamus, we have a group of nerve cells that form what we call the suprachiasmatic nucleus, the SCN. And these nerves function as a master circadian pacemaker that basically controls our sleep-wake cycle. We also have these peripheral clocks in other areas of the body. So for example, the liver, the smooth muscle, the adrenal glands, and even in the immune system. In fact, it blows my mind that neutrophils, natural killer cells, macrophages all have their own intrinsic clock. So I guess I want to make it clear that 1 to 2 nights of going to bed at 3 a.m. isn't a big deal. We don't want people to stress out if, a couple of nights they're going to bed late. However, chronic sleep deprivation and the subsequent circadian rhythm disruption that occurs with it is so common in our 24/7 society, and this alters the expression of circadian clock genes, causing abnormal expression of these genes, which, as you kind of mentioned, is linked to a lot of chronic diseases, including metabolic syndrome and depression. So getting natural light, but also working with nature's cues and going to bed when it's dark or really at the right time is really, really important.
That's great. Thanks for that, Lisa. Yeah, certainly, the light's dark exposure certainly has a significant impact on our overall well-being and our genes, as you mentioned. So that's a great myth to dispel. So, Emma, can you tell us about a sleep myth that you want to dispel today?
Yeah, I'd like to cover two, and they are both on life stages. So the first is new mums, and the second one I want to touch on is the elderly. Now, I work with a lot of sleep-deprived mums, and it's a myth that they need less sleep. New mums need the same amount of sleep as other adults, which is about 7 to 9 hours a night. But due to the demands of caring for a new bubba, achieving that is almost impossible. I know from my own experience it was impossible. And in reality, many new mums experience what we call fragmented sleep, averaging around 5 to 6 hours in a 24-hour period. But it's often accumulated in short bursts rather than a block. And these short bursts of sleep prevent a mum from achieving continuous restorative sleep cycles. So instead of progressing through the sleep stages of light sleep, deep sleep, and REM sleep, the repeated awakenings really impact that sleep architecture, and less REM and deep sleep occurs. And so sleep overall is way less restorative. And the lack of sleep can significantly impact a new mum's physical and emotional well-being. Research shows that brain function is profoundly affected, particularly regions related to mood regulation, stress response, and cognitive processing. During that postpartum period, women experience changes in brain connectivity and hormonal regulation due to this sleep fragmentation. And what's interesting is that neuroimaging studies reveal that disrupted sleep alters the function of the amygdala, the prefrontal cortex, and the hippocampus, which, as we know, are key regions involved in emotional regulation and memory. And then that leads to this heightened stress response and emotional reactivity, making new mums more susceptible to negative emotions, which is just making a challenging time even more challenging. Now, the next myth I want to bust is that older people, so let's say people older than 65, the myth that they need less sleep. Now, while it's true that sleep patterns can change with age, people still need that 7 to 9 hours of sleep per night. And, sleep patterns can change due to medical conditions as we age, like sleep apnea or restless leg syndrome or that sensitive bladder or perhaps chronic pain, with these all tending to decrease the amount of deep sleep and create more sleep disturbances. And as we know, adequate sleep supports that memory consolidation and cognitive function. Poor sleep is linked to an increased risk of cognitive decline and conditions like Alzheimer's, and sleep disturbances can impair attention, memory, and decision-making abilities, which are really critical in the elderly for maintaining their independence. And we know that poor sleep is associated with the higher risks of chronic diseases, and research highlights how fragmented sleep in the elderly negatively impacts brain health and the autonomic nervous system, which then regulates blood pressure and heart rate. So we've got those negative effects really disseminating throughout the body systems. And one thing that I really want to emphasise is that sleep deficiency impairs coordination and balance, and this increased the risk of falls and injuries in the elderly. Now, one meta-analysis that I read up on was on over 70,000 elderly people, so people over 65, and they looked at sleep duration and health, and there were some really interesting patterns. So if you sleep less than 6 hours, there was an increased risk of dying from any cause by about 7% and an increased risk of dying from cardiovascular cause by about 18%. Now, conversely, long sleep or sleeping longer than 9 hours increased the risk of all-cause mortality by a whopping 33% and increased the risk of dying from cardiovascular causes by 43%. So this really suggests that both too little and too much sleep are associated with those higher all-cause mortality rates. And it's absolutely a case of finding that Goldilocks zone so that our sleep really positively impacts our health span and our longevity.
Wow, that's great. Thanks, Emma. That's obviously you've highlighted the absolute importance and the role that sleep has on brain function and cognitive health, and certainly more and more research is just showing that we really need to get good sleep to ensure we've got good cognitive health and good brain health. And it's interesting, the research showing about mobility and the impact on falls and things like that too. So it's wow.
Really profound. And when you think about the statistic that I think it's nearly 40 or 50% of people die within a year after their first hip fracture, it's really high rate. So if we can positively impact that, that would be great.
Absolutely. So, Michelle, what about you? What can you tell us in terms of the sleep myth that you want to dispel today?
Well, I just wanted to talk really about adolescent sleep, which is a big issue, and it's almost the start of kind of teenagers entering into that independent adult phase of their life. And it's very common that teenagers will actually have a delayed circadian rhythm. And what that means is that their melatonin starts to be secreted later at night, and therefore they find it difficult to wake up in the morning, particularly because our society's regimes don't change for teenagers. And this is a natural state of affairs. So the melatonin shifting about at 2 hours past normal. So, for example, as the sun goes down and our natural melatonin levels rise to the sun, teenagers are actually much more alert in the evening time. And therefore, if they're due to get up around 7 o'clock, 7:30 in the morning to go to school, this can pose a big problem because they're often going to bed later and not able to get up at that same time. A lot of people have been talking about delaying school start times for a couple of decades now. And it's clear to all of our listeners this hasn't happened in this country or anywhere that I'm aware of. I think in parts of Sweden and some of the other Nordic countries, they're looking into that and have a delayed start time for teenagers to actually accommodate for this natural shift in their rhythm. And so this is really important for parents of teenagers as well, because it's a significant natural change. And if we can support teenagers to get better sleep, it's really important, obviously, for their cognitive function, as Em mentioned, but also their moods, because around that adolescent time, there's a lot of new challenges that they're dealing with, changing bodies, increasing pressure at school. And if we've got a significant number of teenagers that don't wake up and they're half asleep by the time it's midday, we've got some issues with learning, potential learning and impacts on cognition.
Yeah, no, great points. You know, I know that certainly people have been talking about delaying school start times for a long time now, and there's been no change. I mean, obviously, there's a whole range of ramifications that might happen in terms of lifestyle and also ensuring that kids don't then now go to bed even later to so that's
right.
going to always occur too. But I think they're really, really good points. All right, and Mick, can you tell us about a sleep myth that you want to cover today?
Yeah, sure. It's the myth that napping solves everything. So when people think of napping, they think that they only think of the benefits that occur with it. And while it's generally beneficial, there are a few issues that people need to consider. So your short daytime or siesta-type naps of less than 30 minutes are generally beneficial. They have some cognitive effects in that they enhance wakefulness, they help with memory consolidation, learning, they improve executive functioning, and they also help with emotional stability. There's also some physiological benefits to it, things like reducing cortisol levels, reducing long-term risks of cardiovascular disease. They counteract the effects of sleep deprivation, long-term sleep deprivation, and they can certainly support immune function. They're also quite good to mitigate some of the problems that occur from shift work long-term. The issues come when people start to nap longer than half an hour, and that sweet spot's somewhere between half an hour to an hour, but over an hour, you can have other issues such as productivity loss if your naps are longer than an hour. You can be more prone to things like sleep inertia, and there are poorer health outcomes, much like Emma mentioned before, things like increased risks of diabetes, hypertension, and cognitive decline can occur. Now, this is even worse if you combine these long naps with disrupted sleep at night time. For example, if you're sleeping less than 5 hours at night or longer than 9 hours. Now, there was one study that showed that there was an increased risk of 26%. It was people that had these longer than 1 hour naps and then slept less than 5 hours or longer than 9 hours had a 26% increased risk of developing type 2 diabetes compared to groups that napped less than an hour or those that didn't nap at all. Now, interestingly though, the group that didn't nap at all, even in that group, for people that slept less than 5 hours, there was definitely an increased risk of type 2 diabetes. So I guess the rule of thumb is, yes, napping is okay, but make sure you schedule your naps into your day, keep them less than 30 minutes. And the good news there is that you can certainly do it several times a week. However, the downside is the benefits of napping are really short-lived. They last from around up to about 6 to 8 hours. And unfortunately, they don't extend into the following day in cases of chronic sleep disruption.
Wow. No, so I mean, obviously, then, as you've mentioned there, obviously naps can be healthy, but obviously it depends on the length of the nap and the timing, and those things are really important when it comes to considering napping. And I know that some cultures, they encourage napping during the day, and others don't. So it's great to dispel that myth and to clarify the pros and cons of napping. Thanks, Mick.
Cheers.
So thanks, everyone. So I suppose what we need to really highlight here is that, it's important for people not to believe everything they read or hear, and to really do their research and use credible sources. And unfortunately, I don't count TikTok and YouTube as credible sources. And unfortunately, that's the reality. That's where people are getting their information. So it's absolutely important that rather than just accept some information that's been presented, to people just ask more about where that information's come from and is it a credible source. Now, certainly when it comes to sleep, we're learning a lot more around the complexities of sleep. Obviously, the research is also showing us that we know we need to learn more and more about it. But the reality when it comes to sleep is that from a physiological perspective, there are many biological processes that are absolutely important and have a really important role around falling asleep, around staying asleep, around obtaining refreshing sleep. So those things, those physiological processes I think it's important for us as practitioners to really understand what they are, what factors are going on in the body, what processes are going on in the body that are important to promote healthy sleep, and what disruptions can occur that can impair sleep quality. And so understanding pathophysiology can guide our assessment and can help us work out lifestyle and environmental and psychological and medical factors that affect these processes. And I think that's why an integrative approach is so important, because there's so many possible physiological processes that can be impacted, and we know that there's a whole range of different factors that can impact on these. So Michelle, can you tell us about one physiological process that you think is important for sleep?
One of the most common issues that our society face is this metabolic dysfunction that ranges from things like prediabetes to diabetes, polycystic ovarian syndrome, fatty liver and metabolic syndrome, etc. But even just central obesity and these changes in body habitus that is due to the underlying issue of blood glucose dysregulation and likely insulin resistance. And one of the reasons why blood glucose dysregulation causes poor sleep is because of its impact on micro-waking. So often when people have issues with blood glucose dysregulation, they may have issues with both high blood glucose and low blood glucose. So hypoglycemic events overnight are associated with micro-wakings, meaning the person may not even be aware that they have woken. And that's kind of similar to what we see in sleep apnea. And so we know blood glucose will naturally drop overnight. That's quite normal. And as Lisa mentioned before, even our hormones go through circadian rhythm. So insulin and glucose and a lot of the other associated hormones have a natural circadian rhythm, similar to cortisol. So poor sleep can impact the physiological role of insulin, leading to insulin resistance the following day. And you'll often see in clinic when people have poor sleep, they often find it very difficult to maintain the healthy lifestyle choices we're often advocating for them. For example, if somebody's having a wakeful night because of a crying baby, or it's often difficult to stop those natural sugar cravings that occur because of the instant insulin resistance that occurs after a poor night's sleep. And so this is really, really critical for people to understand, because as we all know, and particularly the avid listeners to the FX Medicine podcast, a lot of our issues come from these very, very common lifestyle issues that we have. Increase in simple sugars, decreases in protein, increases in highly processed foods, lack of exercise, sedentary behaviour, increased stress, and they all play a part in blood glucose dysregulation. So you can see that it's a critical issue. The other huge physiological process which is similar to blood glucose dysfunction comes by way of alcohol. So often what you see is when people have poor sleep initiation, they'll often turn to alcohol as a way of settling them down, having a relaxing kind of nightcap at night. And that often helps people fall asleep initially. But what alcohol does is it dramatically dysregulates your blood glucose levels. So what happens is that when there's alcohol in the system, the body will preferentially detoxify alcohol to sugar. So the body will always detoxify the most toxic thing within the bloodstream at the time. Alcohol beats sugar every time. And so the liver's busy detoxifying this toxin, and it's not actually dealing with things like gluconeogenesis, and which results when the alcohol is cleared in often a low blood glucose levels. So this combination of glucose dysregulation, metabolic inflexibility, and alcohol can really increase to poor sleep and lead to both daytime worsening of insulin sensitivity. So it's a really easy thing to address straight off the bat.
Wow, that's great. So here we're seeing that obviously sleep can affect our blood sugar regulation, and that poor blood sugar regulation can affect sleep. So there's that bi-directional relationship. And it's fascinating that you mentioned that it also affects insulin resistance the next day, which is just fascinating. So Emma, what would you like to cover in terms of a physiological process that's important for sleep?
Oh, I really wanted to talk about the link between inflammation, gut health and sleep, because I see so much of this clinically. There is a really strong bidirectional relationship between the central circadian rhythm in the brain and then the peripheral circadian rhythm in the gut. And if one is impacted, it generally has a flow-on effect to the other. There's also a bidirectional relationship between sleep and inflammation, where certain inflammatory markers follow circadian rhythms, like we have spoken about with hormones. Everything has a rhythm, and these inflammatory markers show fluctuations depending on the time of day. And then in turn, pro-inflammatory cytokines like interleukin-1 and TNF-alpha have been shown to modulate our sleep architecture. So for example, a great insight here is that rheumatoid arthritis patients experience increased joint inflammation and pain and that early morning stiffness. And that results because of the nighttime synthesis and release of these pro-inflammatory cytokines, which leads to that cell migration to the inflamed tissue, which makes everything worse. And it really just highlights how inextricably linked sleep and inflammation are. And when you have a look at the research on the gut microbiome and its role in insomnia, there's a correlation between CRP levels and the risk of insomnia, which I find really interesting. And the risk was increased in the presence of certain bacterial strains. So we know the vagus nerve detects and sends pro-inflammatory signals from the gut back to the brain. So essentially we're seeing that dysbiosis causes inflammation, which then drives up the risk for insomnia to actually occur. And then we also look at the expression activity of key antioxidant enzymes like superoxide dismutase, and they also have their circadian patterns. And then disruptions to that circadian clock cause a increased level of oxidative stress and the systemic inflammation. And we particularly see this in things like, as Michelle said, metabolic syndrome and insulin resistance and sleep apnea. And then when you look at gut diseases themselves, things like, gastric dyspepsia, inflammatory bowel disease, IBS, reflux, these are all linked to disrupted circadian rhythms and changes in gut microbiota composition. One study I looked at was so interesting. They took mice and they knocked out their key circadian genes, and directly there were shifts in their gut microbiota. So it just shows how incredibly linked all of this is. And yes, a naturopath, we always just want to get in there on the gut and start optimizing things. But interesting, the link between sleep, inflammation and gut.
Great. So sleep can be a pro-inflammatory, if it's poor, can be a pro-inflammatory agent, or it can be an anti-inflammatory agent. So that's and it's interesting that the relationship between inflammation and obviously antioxidant activity. So potentially sleep can serve an anti-inflammatory intervention, and then it can also be a good option to increase our antioxidant defences, I suppose, too.
Yeah, exactly. And I'm often saying to patients, when you're sleeping, you're healing, and, a magic pill will not replace that. So sleep is so profoundly important to reduce that excess systemic inflammation. Yeah.
It's actually got me thinking, with some of the things that you mentioned there and Michelle just mentioned previously with regards to that obviously poor sleep can increase inflammation and then might increase pain, and therefore people are in more pain, so they're less active during the day because of that. So then that has a detrimental effect on their sleep. And then Michelle mentioned about insulin resistance. So the insulin resistance is worse the next day, which then impacts on their hunger and satiety. And so therefore their diet may change and the foods that they're eating might change. And then that has a negative effect on sleep. So we have all these other factors that are going on, not just the sleep, but the behaviours that occur as a result of poor sleep that goes on too.
Incredibly fascinating, right?
Yeah, absolutely. Now, Mick, we're learning more about the role of neurotransmitters that are important for sleep, and these can include things like melatonin and adenosine and orexin and dopamine and GABA and serotonin and noradrenaline, and I could keep going on and on. So, and I know that some neurotransmitters are sleep promoting, while others are wake promoting. Can you tell us a little bit about one or two neurotransmitters from each category that are important for sleep?
Sure. So when we're talking about neurotransmitters, it's really the balance that regulates our sleep-wake cycle. So no surprises here. In terms of sleep-promoting neurotransmitters, melatonin we'd all be aware of, also known as sleep hormone or the hormone of darkness, makes it sound more like a supervillain than an actual hormone. I must say, I really loved that episode that when you interviewed Deanna Minich, and so that was a really fascinating episode, and I'll be precise here when I talk about pineal melatonin, because I know it exists in pretty much every cell of the body. So with melatonin, pineal melatonin rises in darkness, with our levels being around 10 times higher in the evening than they are during the day. We know it acts on MT1 and MT2 receptors, signalling that it's time for us to go to sleep. It certainly creates feelings of drowsiness, lowers our body temperature, and also at the same time as our melatonin levels rise, our cortisol levels start to drop. The next key hormone or neurotransmitter is gamma-aminobutyric acid, or GABA. It's involved mainly in that transition from wakefulness to sleep, and it turns off a host of other neurochemicals, things like serotonin, histamine and noradrenaline, all these wake-promoting cognitive type neurotransmitters. And we know that GABA-A receptors are those key receptors that most sleeping agents or drugs that are used for insomnia act on. Things like benzodiazepines act on those, as well as the Z drugs, things like zopiclone and zolpidem. And GABA is also involved in the maintenance of REM sleep. Now, it'd be remiss of me not to make a very minor mention of adenosine. Adenosine accumulates during our waking hours, and then it creates a pressure to sleep in the evening. So it's involved in that concert of the symphony of sleep, I guess, if you want to say it in that way. Now, when it comes to wake-promoting neurotransmitters, cortisol is probably the main one. Our levels rise in the morning. They peak around the time that we wake up, and it helps boost our body for the day ahead. It increases our alertness, our energy, kickstarts our metabolism a little bit. So it prepares us for that day ahead, as I said. Then the monoamines kick in, things like adrenaline that pumps up our heart rate and blood pressure, noradrenaline that increases our focus and attention to the environment, and serotonin that helps with our wakefulness but also regulates mood, as does dopamine to a point, as well as increasing our cognitive function. Then we've also got hypocretin, or orexin, people may know it as. It's involved in the release of glutamate. It's involved in quite a lot of weight-promoting pathways. And here's where drugs like suvorexant, which are these orexin receptor antagonists, work via this pathway to help with insomnia as well.
That's great. I mean, obviously, we're talking about all these different processes separately, but they're not mutually exclusive. We certainly know that inflammation will affect these different neurotransmitters, and our blood sugar and insulin levels will affect these chemicals in our body too. So they obviously have a significant interaction between all these physiological processes. Now, Lisa, can you tell us about another biological process that would be important for sleep?
Yeah, sure, Adrian. So I'm always interested in looking at the underlying pathophysiology with regards to women presenting with hormonal disruption and the subsequent effect that has on their sleep and their circadian rhythms. So what we know is that there are steroid hormone receptors all over the brain. So there's receptors for estrogen, progesterone, and basically we find them in areas of the brain where that are involved with sleep regulation. So fluctuations in these steroid hormones, whether that be across the menstrual cycle and or even at other times, for example, in perimenopause, can subsequently impact sleep. And it's not just the steroid hormones. We also can consider thyroid hormones as being very much involved with sleep regulation. So disruption of these hormones will cause problems for women and men too, if there's a thyroid issue. So on a deeper level, ovarian steroids like estrogen and progesterone actually influence circadian rhythms, including sleep-wake activity. And this is through direct and indirect effects on that master pacemaker we were talking about, the suprachiasmatic nucleus. Estrogen is also involved with the metabolism of serotonin and acetylcholine. As Mick said, they're both neurotransmitters that affect sleep pattern. So if we are seeing issues with estrogen, then we'll also see those neurotransmitters affected and sleep can be impacted. It's not just about estrogen though. Progesterone stimulates the production of GABA, which we know also helps with sleep. So again, that low progesterone or it dropping too rapidly can cause problems with sleep as well. And then with the thyroid hormones are very much involved with sleep maintenance and deep sleep activity. So it's a no-brainer that if the thyroid is not working well, then sleep will be impacted. Now, we know with hyperthyroid, excessive thyroid hormones is going to cause increased excitation. Pretty obvious that there'll be insomnia there. But a lot of people don't know with hypothyroidism that there can also be insomnia and sleep issues. We kind of think that because they're hypothyroid, they're going to be exhausted and wanting to sleep all the time, and that's certainly true. But often my patients with Hashimoto's or hypothyroidism find it very difficult to get a good quality sleep, and they may also struggle with insomnia. So there's many reasons for this, but one example could be that the thyroid hormone T3 is very much involved with transmission of neurotransmitters. So if it's not doing that properly, then we're going to see impact with sleep because those neurotransmitters won't be at that kind of right level that they're meant to be at.
Well, that's great. So again, you're highlighting the interaction between all these different hormones and neurotransmitters, and obviously it also impacts on inflammation and so on and so forth. And I suspect changes in sex hormones for women, particularly over menstrual cycle, will also impact on their sleep. So it's probably a good question for us to ask whether their sleep changes occur based upon where they are on their menstrual cycle.
Absolutely.
Great. So thanks, everyone, for that. So obviously the physiological processes are complex. There's not just one. It's not just about increasing melatonin, where all we need to do is take melatonin and we'll sleep happily ever after, because that's certainly not going to happen. So there's no single simple solution. And it's important for us to identify the pathophysiology for the person sitting in front of us. And it could be very different for different people. And that's why potentially treating sleep can be quite complex, because one physiological process may be disturbed to one person, but not so for the other. So therefore the intervention can be very different. And that brings us to the next topic, which is the assessment. Obviously, trying to work out what's going on for the person sitting in front of us is absolutely imperative and crucial to help us identify the potential treatments and options for that individual. So, Emma, can you tell us about one assessment option available that is important for sleep
Yeah, sure. Look, I am a big fan of wearables. I'm a bit of a data girl, and so numbers really make sense to me. But when we look at the research, it is clear that nothing is perfect. Everything has its pros and its cons. Like the Oura Ring correlates the resting heart rate very closely to an actigraph, which is a wrist device often used to assess sleep-wake cycles. And then something like the Polar Watch tends to over-report the activity and the steps. Now, even the best trackers will have at least a 10% variance, so you have to take that into account. But what's interesting is that research is showing that as technology is improving, the data accuracy is also getting better. For example, when HRV was added to the Oura Ring, the deep sleep measurements became more accurate. So it is really worth keeping an eye on how technology will be able to give us better data in the future. Don't discount it. It's always improving. And personally, I use an Oura Ring. I really love zooming out and looking at the data on like a week-by-week basis and detecting those trends. I don't look at it day by day and make decisions, but zooming out and looking at trends really helps me stay accountable to my health goals and keeps me really motivated because I can see the trends changing when I implement a health behaviour. Now, clinically, I am really selective about which patients I recommend wearables to. If they're like me, they like data and appreciate numbers. This is all my accounting patients. Or the other group I use it for are those people that just won't have the compliance to do a sleep diary or an activity diary or a food diary or whatever it might be. They could be a good candidate for a wearable. Now, one patient said to me just last week, and it was interesting because I was researching for this episode, and she said it so beautifully. She said she loves tracking because it helps her build awareness and knowledge around her house. She found it really empowering, the knowledge that she gained from doing the tracking. But of course, if someone tends to have anxiety or they tend to get micro-fixated on data, these are the patients that are emailing you 10 times between appointments, double-checking they've got it right. I definitely would not recommend any wearables to them. So pick and choose your patient wisely, but they can be so empowering when used correctly.
Great. Some great advice there. So, obviously there's the number of different options available. You've mentioned the Oura Ring, and then there's your different sports watches, you've got your Fitbits, and you've got your Apple Watches, and all those different wearables can also provide different data, which is great. And I think it's really important that you mentioned there that be selective about who it may be beneficial for. For some individual, it may be for anxious. And I think also people who are a bit more hypervigilant about their health in general, I think that's where we need to be a little bit careful about that. So well, recently, we just completed a study where we used the Oura Ring as an outcome measure, as one of the outcome measures for a magnesium cognition sleep study that we've just completed. And we used the Oura Ring along with a whole range of subjective questionnaires around sleep quality and restorative sleep. And interestingly, what we did find was that the data obtained from the Oura Ring didn't actually have any correlation with their subjective sleep questionnaires, the scores on the subjective sleep questionnaires, which is not uncommon. Often the objective data doesn't necessarily correspond with the subjective data. So it's important to have both. The only data that we found that was that was associated with the subjective sleep questionnaires was their resting heart rate during sleep. So if their resting heart rate was lower while they slept, they had better sleep quality as based on the subjective questionnaires. They had better restorative sleep, and they even had better emotional well-being. So that's interesting. And I think my theory is that the resting heart rate was lower, which meant that they went more in a parasympathetic mode while they were asleep, and then they kind of felt better when they woke up during the day.
Yeah. And look, the power of the mind on sleep and your perception of your own sleep is huge, isn't it? If you wake up and you feel like you've had a bad night's sleep, it doesn't matter what the data tells you, you're going to say, oh, I've had a bad sleep. So it's really important to take that into consideration as well.
Absolutely. The research continually shows around the role that placebo has. And if you think that something's going to be beneficial, then it certainly may be. Now, Michelle, what assessment do you think is important for sleep?
Well, I'm a big fan of sleep studies, and really that was revolutionised by taking them out of the hospital setting and putting them into a home-based sleep study. And the reason why it was so fantastic was a sleep study now in your own home is far more accessible than it was 10 or 15 odd years ago. And that means that somebody can be set up to do a sleep study in their own bed, in the comfort of their own bed, rather than in a bright light, noisy hospital setting, which was often a turn-off for lots of people. And what a sleep study can do, or particularly a home-based one, is actually give you a deep dive into the quality of the sleep that person is having, and also assess for the major sleep issue, which is sleep apnea. And sleep apnea is a huge problem in our society. It is older men, particularly those with a large neck. There's obesity, if there's central obesity, if there's issues with reflux, alcoholism, stress, those kind of things increase that risk of sleep apnea. And a sleep study can determine whether it's an obstructive sleep apnea or a central-based sleep apnea. And it can also have a look at other aspects of sleep that can be pertinent. Keeping that in mind, there is a difference between a home-based sleep study and a hospital-based sleep study. And a hospital-based sleep study is required if you're suspicious that there is a more rarer cause of these sleep issues, things like narcolepsy or periodic restlessness or restless legs. And those kind of things can really impact a person's sleep long term. And so it's often indicative of some other neurological components that are a little bit more on the rarer side of things. I think sleep physicians and the whole science of sleep medicine has really transformed in the last couple of decades. And that means that there is a lot of fantastic interventions that are beyond the CPAP machine. I remember going through medical school and the CPAP machine was about the size of a small vehicle at that stage. And it sounded like an aeroplane in the room, and it was particularly distressing for the partners that didn't have sleep apnea. And so now there's been so much research into fantastic interventions that it's so much more of an easy intervention for people to use. Having said that, there still is a lot of issues with compliance. But in addition to something like CPAP, there's so many fantastic interventions that we can look at when we know exactly what's happening with your sleep. And there's also a whole range of new medications that don't interfere with sleep architecture that can really help with some of those neurological issues that may be resulting in a poorer sleep outcome. And so there's some really, really fantastic things to help support people that have had recalcitrant cases of insomnia.
That's great. I think some great advice there with regards to doing more comprehensive assessments to see if there's sleep going on.
Yeah, for sure.
I know a questionnaire that I've used sometimes when I suspect sleep apnea is the Stop Bang questionnaire.
Yeah.
And it's very simple. So, I mean, from memory, it's S was snore, T, they're tired during the day, has somebody observed them stop breathing? Is their blood pressure high? Is their BMI greater than 35? Is their age greater than 35? Is their neck circumference greater than 50 centimetres? And are they male? So if they tick many of those, then then we certainly need to recommend a more comprehensive sleep assessment. So that's brilliant.
And of course, there's the Epworth Sleep Study as well, which is a super easy thing to get people to do as well, which is a really simple questionnaire. And the combination of those two, I think, is really effective for choosing which patients that you might actually advised to have a home sleep study for. Because but having said that though, I have often given people a sleep study and that they have a normal body habitus, they wouldn't fit into that classic criteria. And I think that's really interesting too. So for those recalcitrant cases, sometimes a sleep study is something that you need to consider, just even in the people that you don't think fit that criteria, because I've seen it time and time again.
Brilliant. Yeah, I absolutely agree with that. All right. Now, just quickly, do you do any testing for cortisol or melatonin? What's your experience with regards to things like that?
I do. Yeah, I love that test. I think I mean, I think lots of people have problems with chronic stress these days. I'm pretty sure all the other ambassadors would agree with me too. Like, I mean, stress is probably one of the biggest issues that's really kind of been catapulted into the limelight since COVID-19 has revealed how stressed out our society is. But I do like doing those tests, A, because I can see whether there's a circadian mismatch. B, I can show the patient the impact of stress, because a lot of people normalise stress over their lives and they've been stressed like that for maybe 10, 20 years. And so they don't actually understand the kind of long-term wear and tear impact that can happen, particularly for, say, for an example, a perimenopausal woman. So they go along quite nicely with the level of stress that they're coping with. And then something like perimenopause, when the hormones are shifting, the brain architecture is changing, that's enough to send them into insomnia or problems with sleep, problems with energy management as well. I think it's a lovely test. I think it's super cost effective. I think it helps to kind of sell your story, to get people in that psychoeducational component, to really bring awareness and buy-in.
Yep. Yeah, I think I agree. I think there's pros and cons to doing assessments for cortisol and melatonin, and I think sometimes even just doing a melatonin test and an evening melatonin, and it's letting your client know that it's low might help motivate them to make the changes that they need to do to 100%. Ensure that so it can also be a tool from that perspective. And it can also be a tool if it's all normal, to move on and sort of go, okay, well, maybe we have to look at a different way of assessing this person. And the other thing that I think is really interesting, we were talking about wearables before, is the role of a CGM outside of the realm of type 2 diabetes can be helpful in assessing that glucose dysregulation that we were talking about before. So that's another wearable that I know Em's a fan of as well, and can show that blood glucose dysregulation night and day. And that can be a really nice opportunity for people to take a look inside their physiology and see whether that's a problem for them. And for our listeners, CGM stands for?
Continuous glucose monitoring.
Terrific. I'm sure most people knew that, but all right.
Thanks,
So Mick, what about yourself? What recommendations do you have around assessment for sleep?
Well, sleep questionnaires are quite useful. They're quite useful. They certainly have a role in research, and they do also have a role in clinical practice. They give us information about several metrics associated with sleep. They measure things such as sleep onset latency, waking after initial sleeping, total sleep time, total time spent in bed, things like sleep efficiency, where it's the percentage of time you're actually asleep compared to the total amount of time you're in bed. And it can also look at other things such as sleep quality and satisfaction. But we have to remember that these are subjective measures or a subjective appraisal of each night's sleep. Now, the one thing is that no single questionnaire includes all of these metrics. And of course, we know that alterations in circadian rhythm affect not just sleep cycles, but they also affect us during the day, our cognition and our wakefulness during the day. So it's interesting, or it would be appropriate for some of these questionnaires to include daytime effects as well as nighttime effects. But I've put together a little pros and cons about this, but I'd really love to hear your take on it, Adrian, at the end, because I think you'd probably use this a lot more than I would. So the pros are the questionnaires provide a standardised method for collecting data, which can certainly help when you're comparing results between across different studies or in different patient groups. They're relatively cost effective in that they're inexpensive compared to other diagnostic tools, things like polysomnography and things like that. They're non-invasive. They can be done in your own home or in a sleep study in a centre if you're there. And they are reasonably comprehensive in that they can gather a wide range of information about the patterns and the habits of someone's sleep and also their perceptions of how they think they've slept. And they're relatively easy and quick to fill in, so they're fairly time efficient. They don't take long to fill in. Now, the downsides are that no two questionnaires really are the same, although I did read somewhere that the Consensus Sleep Diary has tried to approach this goal and have a sort of all-in-one type questionnaire that can be used across different areas or different studies. And of course, the responses that people give, they're actually subjective. So we're relying on people's perceptions of how they slept and their memory. So you need to use other tools to have a look at the objective measures of how they slept. Things like continuous glucose monitoring and other things can actually assist physiological effects that are affecting their sleep. They may not necessarily capture all the aspect of sleep disorders, and there can be variability in interpretation. Some individuals might interpret certain questions differently to other individuals, and you may get differences in responses there. But there can also be a potential for bias, whereas some people may intentionally underreport or overreport symptoms due to social desirability, or once again, there could be a misunderstanding of the questions. And because they're subjective and people fill these in after the fact, there's a lack of real-time data, so they don't provide this real-time information or insight into the sleep architecture. So they're best used probably in conjunction with other diagnostic methods. So I guess probably summing up, they're very useful to give us information about sleep data. Unfortunately, most of them are subjective. That's not always an issue, but if they're used with other diagnostic tools, they certainly can give us information that's useful for treatment. Now, before I finish though, there was a review of some of the wearables that I found, and I'm quite happy to share a link in the podcast notes of that. There was a 2024 review, but once again, some of the other ambassadors have used those wearables, so it'd be great to get their feedback. And also, Adrian, I'd love your thoughts on the sleep questionnaires.
Yeah, I mean, look, I think I agree. There's certainly pros and cons of using different questionnaires. And for our listeners, some sleep questionnaires can include things like the Pittsburgh Sleep Quality Index or the Insomnia Severity Index. There's one that I like and I've used for many of my studies, a Promise Sleep Questionnaire. There's a Restorative Sleep Questionnaire. So there's all those different options that are available, and a lot of them are quite short to do. But I think the key here is to go, is in administering a questionnaire going to add anything to my assessment? And if it is, then great. If not, then don't use them. Don't overwhelm our clients. And I think the great thing about some of the questionnaires is that they come up with total scores, so you can assess change over time. And often what happens is that I find that with clients, for example, or even in research, people expect perfection. So they come in with sleep-related problems. Their sleep is better, but it's not perfect, and they think that the treatment has been ineffective. So you can use the questionnaires to go back and say, well, you scored 30 at the beginning of our intervention, and now it's 15. So there's a 50% improvement. It's not perfect, but there's a 50% improvement. And so that they can then provide some information for clients to really acknowledge some of the changes that the interventions or the strategies that have been promoted that actually may be helpful. There actually are significant improvements over time. So I think that's the great thing with regards to the total scores. The other thing with regards to questionnaires is that the individual questions can be used to help clarify more information. So if somebody's indicated that they have problems falling asleep, then they can use that as a prompt to help to ask about days of the week that they have problems falling asleep, foods that might impact on their sleep, behaviours that occur before bedtime that might be impacting on their sleep. So they can kind of be prompts there. So definitely pros and cons, and as I mentioned, only use them if you need to. So thanks for that, Mick.
Cheers.
Now, the next topic I wanted to cover was some around sleep disruptors. So there's a whole range of factors that can affect our sleep. There's some things that can actually improve our sleep, and some things that can actually impair our sleep, can affect our ability to fall asleep, stay asleep, or feel refreshed when we wake up. And so changes in our lifestyle and environment and increased technological advancements have unfortunately increased, I think, the number of sleep disruptors that are occurring every decade. And one is around medications, and the data from the Australian Bureau of Statistics have indicated that approximately 70% of people in Australia were dispensed with a pharmaceutical medication in the previous 6 months. So that's a huge amount of people have been giving a pharmaceutical medication. And obviously this proportion of medication use and prescription use increases significantly. And I read, surprisingly, that they were saying that almost 98% of people aged 75 years and over will have been dispensed a pharmaceutical medication in the previous 6 months. So that's huge. So, Mick, can you tell us about some of the common medications and supplements that can affect our sleep?
Sure. So when it comes to medications, I guess how long's a piece of string? Because really there's quite a lot of medications that can affect or disrupt sleep. So what I've done to try and expedite this a little bit is I've looked through the top 50 medications that are prescribed on the PBS here in Australia and had a look at some of the drug classes that generally can disrupt sleep or have an effect on our sleep. Things, and we look at things like bronchodilators like salbutamol can have differences. Some SSRIs like fluoxetine and sertraline, for example, SNRIs like venlafaxine and duloxetine can make a difference. NDRIs like bupropion and also varenicline, which is a partial nicotinic acetylcholine receptor agonist. So these two medications, bupropion and varenicline, are used for smoking cessation. And one thing I found when I dispense these medications is a lot of people will get these incredibly vivid dreams with these things to reduce smoking, to the point where they actually bring medication back because they think they can't tell the difference between reality and dreaming. That's how bad it is for some people. Things like acetylcholinesterase inhibitors, things like donepezil and galantamine, that makes sense because you're trying to raise acetylcholine. If your acetylcholine levels go up, it can sometimes stimulate processes in the brain or thinking in the brain. Of course, stimulants for ADHD can disrupt sleep. One thing I wasn't totally aware of was beta blockers, in particular things like metoprolol and propranolol. Propranolol we don't see that much these days except for things like migraines or public speaking, but metoprolol is certainly used quite a lot still. Diabetes meds, and this talks to a little bit about what Michelle was saying. Some diabetes medications, things like sulfonylureas, can drop people's blood sugars a little too low when they sleep. Then you get these micro awakenings, or hypoglycemia can affect their sleep. Pain meds can certainly disrupt sleep patterns. And corticosteroids, people that are taking short-term or even longer-term prednisolone, that initial dose of prednisolone won't do much, but your subsequent doses, if they're too late in the day, will keep someone awake. And what surprised me was progesterone. I would have thought progesterone's more involved to help people sleep in a general sense. Most women say it helps them sleep, but it can disrupt your sleep a bit, as does DHEA. Now, when it comes to over-the-counter products, we all know of pseudoephedrine certainly can disrupt people's sleep. And if we look at social drugs, of course, we've spoken about the effects of alcohol on sleep, but also nicotine and caffeine. Of course, we know caffeine influences adenosine receptors and can keep us awake a little bit. But some interesting facts with caffeine is that we find it now a lot in energy drinks and sports supplement drinks. So these sports drinks generally can have stimulants, but also combined with high levels of sugar. So these can wake you up and spike your sugar levels, only for them to drop again when you sleep. And then we have these sugar dysregulation effects, and it can have these disruptions to our sleep patterns. Another thing that they add to these sports drinks are amino acids. And some of these amino acids can raise our serotonin levels at times when we actually want them to be lower. And that speaks a little bit more to Lisa's point before about things or neurochemistry rising at times when we don't really want it to. So there was one study I found that looked at the use of caffeine alongside of low levels of taurine in these energy drinks. And they found that low levels of taurine associated with reasonable levels of caffeine can cause insomnia and other adverse effects. But what I found was interesting in that study is that higher doses of taurine actually had a sedative effect. So it's these low levels of these amino acids with the caffeine that are disrupting sleep. Now, when it comes to natural supplements, I've had issues myself with patients in the past that have used things like St. John's wort, valerian, SAMe on the odd occasion, and CoQ10 sometimes, particularly if the dose goes up a bit. So they're the experiences I've had with some of those natural supplements, but I'd really love anyone else to jump in here and let me know if they've had experiences with some supplements.
Yeah, I mean, certainly with the valerian, I've actually had pros and cons, even though valerian can be good for sleep. I've had some people who report negative effects from the valerian. So, and I think the other thing too is that the timing is important. So when they're taking it, and as you mentioned, obviously the circadian rhythm is extremely important, and obviously the dosage plays a part. And I'm always asking when there's a sleep onset problem, when it's a recent problem, what changes have occurred? And I'll certainly ask around medications and changes in medications, changes in dosages, new supplements that they've incorporated, because I suppose it could be anything.
Yeah, that's right. It's interesting. A lot of people don't always reveal supplements because they feel like they're not important to reveal them when you're talking to them or getting a bit of background on them. Although they tend to be okay with me because I straddle both fields, I guess. But a lot of people, when they go speak to a pharmacist, they won't necessarily mention their supplements.
Yeah, absolutely. Okay, now Michelle, can you tell us about a sleep disruptor that you want to cover?
I'm going to talk about screen time. It is probably one of the biggest changes that we've seen over the last, what's it been, about 12 years since smartphones have come into our lives, and they have probably created one of the biggest shifts in human behaviour that I've ever seen in my lifetime, if not in the last 100 or so years. So a recent study showed that 97% of US kids have some form of screen in their bedroom. And really, we're told that we shouldn't have any screens in our bedroom. When we talk about sleep hygiene, we say get any screen out. But it's not just teenagers that is the problem. It's like, there's a huge increase in doom scrolling in people aged over the 50s, in their 60s, and even older people into their 70s and 80s. Now, there's a strong association between screen use and sleep disturbance. However, the exact causal relationship is still unsure. So we know that the blue light that's emitted from these screens has a tendency to decrease melatonin. But it's interesting when you talk to people, because some people still have quite a fine time about falling to sleep, even though they're using screens right before bed. And so then there's a little bit of research into whether it's the content of the media, whether it's the lack of physical activity, such as like the sedentary behaviour, the posturing. So often we're kind of like crouched over the screen, and there's kind of this hypo sort of arousal, but yet the screen time, the blue light, is actually giving us a hyper arousal. So there's kind of like this mismatch in our activation of our nervous systems. And clinically, and I'm of the same age of having teenagers in my household, the parents that I speak to have significant concerns around screen time, particularly for young children and for their teenage kids as well. And one of the reasons why it's so significant is that teenagers actually have a relatively low dopamine level. And they're actually, part of their evolution is to seek stimulation. And so these social media platforms with the kind of like and the comments and the ability for people to positively or negatively comment on our lives has a significant influence on dopamine. So it's a very easy reward system, but it can be overdone. And the problem with screens is it tends to decrease adolescents' creativity, physical activity, and it has a significant impact on mood. And so we know that things like anxiety and depression have a significant impact on sleep, and poor sleep has a significant impact on anxiety and depression. And then, of course, there's the 5%, maybe even higher, of people in our society that are neurodiverse. And that means that their level of arousal and attentionality and cognition and focus is much more easily impaired. It's a little bit more kind of vulnerable and fragile than, say, a neurotypical brain. And we have to be really cognizant of the impact of screens on that particular vulnerable brain. And so we've got some research saying that teens, particularly during COVID, started using screen time up to 13 to 16 hours a day. It's extraordinary. And so we know that the RACGP put out safe screen time usage, and of course it's 0 for kids less than 2. It's 1 hour between 2 and the age of 5, and between the age of 5 and 17, it's 2 hours. Anybody using screen time above 2 hours is considered a heavy user. Now, we don't even know the impact of what heavy use is for teens and for adults as well. I know my screen time sometimes goes beyond 2 hours for sure. And so we've got to start thinking about the impacts of these screens on our quality of sleep, on our sleep timing, and on all of the other structural factors that can be so supportive of sleep. Outdoor time, time in nature, exercise, lacking sedentary behaviour, better healthy habits, social connection, eye gazing, all of those things that help to build a healthy human being.
Great. Some great points there, Michelle. I think, obviously the screen time has a significant impact on our lifestyle. And as you mentioned, it's not just the screen time, it's all those other behaviours that occur that have changed as a result of the screen time. And, people even can't even go to the toilet now without their screen. So
I know. And interestingly, what they're talking about is like this intensity. So, when you've got screen time below 2 hours, you're probably getting outside and getting all of the natural filtered lights. So blue light, yellow light, orange light, red light, etc. But we have a preponderancy or sort of the major source of light at sunrise and sunset is orange and red and far infrared, and that's far better for stimulating melatonin and supporting our pineal gland and our nervous system as a whole. And we're really missing out on this. And what I loved, I recently came across a term called junk light. So they're talking about the significance of this impact of light now that we've got LEDs, we've got really junky light pretty much everywhere we go due to, our desire to decrease energy costs and support energy efficiency because of global warming. But the problem is that it's at the expense of this beautiful incandescent light that we used to have, which was a yellow light. Now, every light that we see, not only our screen time, our above headlights, shopping centres, workplaces, is full of this junk light. And I think time will tell as to the impact on our nervous systems and neurological systems.
Absolutely. I've been reading a book called The Light Doctor by Dr. Barton Moore-Eid. So that's... And he's also talking about the relationship with cancer risk too. So
yes.
Thank you very much for that.
No worries.
So Emma, can you tell us about a sleep disruptor that you want to cover?
Yeah, that was a nice segue, Michelle, because I want to talk about shift work. And the impact of shift work is incredibly profound, and I feel it's a lot higher than most people realise. And when you look at the research, it's really insightful. So using information from the UK Biobank study, which involved over 350,000 people, researchers showed that circadian rhythm disruption of shift work is linked to an increased blood pressure and heart disease risk in both men and women. Now, in Australia, around 16% of employees have shift work as their main occupation. And Monash Uni did a meta-analysis on over 18,000 Australian shift workers, and it concluded that they eat more calories, they snack on more junk food, and don't eat as many nutritious foods as non-shift workers. And I think we would all agree that's what we see in our clinics. And we can't forget about the impact of shift work on our microbiome. A 2023 review concluded that sleep disturbance or lack of sleep due to night work is associated with metabolic diseases. And in addition, sleep disturbance induces a stress response, both physiologically and psychologically, and it disrupts the healthy functioning of the gut, triggering that inflammatory state that I spoke about previously. So shift workers have a lot working against them that we really need to support them with.
Right. I mean, that's interesting with the microbiome. The damn microbiome, it looks like everything's affecting it. So So we're learning more and more about it, obviously, sleep and shift work. I mean, I don't know. I mean, the shift work's such a complicated issue because, it just can be so detrimental to someone's health. And sometimes, for some people that I'm seeing, it's just, look, you're just going to have to get out of it. It's just not healthy. And for others, it's not so bad. So it really needs to be individualised again. And for some people, they can do it and others they can't.
Exactly, that's right.
And Lisa, what have you got for us with regards to a sleep disruptor?
Well, I think with sleep disruptors, I'm always looking at our own hormones as being part of that too. And I really liked what you said before about asking our clients where they are in their menstrual cycle if they are experiencing sleep disruption, because so many of my clients struggle with sleep in the week or so before their period. And this is really, really prevalent in women with PMS and PMDD. And this is mirrored in the research where women with severe PMS and PMDD often report late luteal phase sleep symptoms, including insomnia, disturbing dreams, poor sleep quality, sleepiness during the day, and just ongoing fatigue. So another lab-based study found that women with PMS and PMDD reported more nighttime awakenings and felt less refreshed compared to controls in their late luteal phase. And another study of female uni students with severe PMS or PMDD symptoms versus controls found that the PMS-PMDD group were more likely to report poor sleep quality. So super, super interesting, I think, to look at our own hormones as disruptors and work on them.
That's great. I mean, I suppose even things like you mentioned previously about testosterone. I suspect there's probably research around changes in testosterone and effect on sleep too.
Absolutely. So we do see with that low-end testosterone more issues with being able to fall asleep and stay asleep.
Yeah. And obviously during perimenopause and menopause, and then you've got the night sweats that are often occurring, which impacts on sleep, and another kind of factor that's going on for unfortunately for women during that phase.
Yeah, so it's really interesting. In some of the research I saw, there's a 50% decrease in serotonin due to that withdrawal of estrogen, and this then decreases sensitivity to melatonin. So it's multifaceted. Yes, the sweats can cause it, the drop in hormones, the change in neurotransmitters, and then the anxiety that comes with all that. Because I often have patients saying, oh, now I'm so tired, I'm anxious because I can't get to sleep. It's this kind of perpetual cycle of problems.
So thanks everyone for this. I think some of these sleep disruptors, they very much link into the pathophysiology, because we're seeing that a lot of these sleep disruptors impact on our inflammation, impact on our gut health, impact on our melatonin levels and our serotonin levels, and all those different factors that are important for sleep. And obviously identifying the disruptors for a specific individual is going to be absolutely crucial. So thanks everyone.
Pleasure.
Thanks,
Thank you.
Adrian.
Thank you.
Thank you.
All right, so thanks everyone. That brings us to the end of part 1, where we've covered a whole range of different strategies and important facts around sleep, and dispelled a whole range of myths and assessment options that we have available. So in the next podcast will be part 2, and we'll cover a whole range of different factors that are around important for sleep. Thank you everyone for listening today. Don't forget that you can find all the show notes, transcripts, and all the other resources from today's episode on the FX Medicine by BioCeuticals website. On behalf of the FX Medicine team, thank you for joining us. We'll see you next time.
This podcast is intended as healthcare practitioner education only, and it is not a substitute for medical advice, diagnosis, or treatment.
If you enjoyed this episode, please take a moment to give us a rating and review on Apple Podcasts, Spotify, or wherever you listen to FX Medicine, and share us with your family, friends, and colleagues.